Today, we have the privilege of meeting two incredibly inspiring doctors who are changing the way the medical community approaches behavioral health. I want to ask both of you what drew you to this wonderful work and this nonprofit that you've started.
Well, I'm a psychologist by training, and I spent many years working in big healthcare settings, supporting patients and supporting doctors. And what I found is that across diagnoses and across specialists, so whether it's a primary care doc or a cardiologist or a psychologist, doctors are constantly making the same 4 behavioral prescriptions. And you can probably guess what they are: exercise more, eat better, reduce your stress, and get some social support. And then the depressing thing is that they then say something like, "Good luck with that, I'll see you in 6 months." And so Ben and I would have conversations where we'd say, wait a minute, if a doctor is going to prescribe medication, like antibiotics, they would never say, you should start antibiotics. Good luck figuring that out, I'll see you in 6 months. Right? They would say, your antibiotic will be ready at the pharmacy around the corner and your insurance will cover it. So we set out to create the behavioral equivalent of a pharmacy, or a accessible, affordable delivery system for the health behaviors that really drive human health and well-being.
Wow, that's wonderful. And Benjamin, what do you feel is the major problem with the way most doctors advise patients to change their behavior?
You know, I really see 3 big problems. The first is the lack of a delivery system, like what Liz was talking about before, where we have these behavioral prescriptions, but no affordable, accessible delivery system or behavioral pharmacy for those. The second is that we treat this as if it's an individual problem, as if patients lack willpower to change, when really it's a structural problem. Our low-income patients have a societal structure around them that predisposes them to chronic disease. And so as they get sicker and sicker, they end up in our emergency rooms and hospitals. And then the third one is that it's just very expensive. That for our folks to treat these diseases after they've become really acute, you're requiring surgeries, you're requiring medication. When we can preempt all of that with behavioral change, it's much more affordable, and it saves so much on just that aspect of human suffering.
And then what does it look like? So a patient comes in to the hospital, to their doctor, and the doctor gives them a prescription. Then what happens?
So yes, a doctor would prescribe usually 4 months as like an initial dose, just like you take antibiotics for maybe 10 days, you get 4 months with us. And then here, I'll show you a little bit about what happens here.
So at Open Source Wellness, we support patients with physical activity, healthy meals, stress reduction, and social support. And we do it in a way that is affordable, accessible, culturally relevant, and experiential, meaning we don't just talk about healthy living, we do it together in community.
When I get home, I don't even really want to smoke. And the whole time up here, I'm not even thinking about a cigarette, you know what I mean? It just, wow.
And I believe that the staff here really want to make a difference. They're young and they're energetic, and so they can keep me moving at a pace that's new for me because I have a sedentary lifestyle.
So that gives you the idea. These are some of our participants, and some of these have actually graduated the program and gone on to become peer coaches, so supporting each other going through the program. So when patients join, there's a large group, but then there's a small group, and so about 6 patients connect with a peer leader and a health coach. And that group is together for the entire 4 months. And that's really the support structure that helps people make and meet the goals that really matter to them.
And that's the community that you were referring to.
Exactly. So this community, they're often on a text thread throughout the week, and so they're cheering each other on, they're helping hold each other accountable. It's really, it's sort of, sometimes we talk about it as re-villaging, that we're not going back to the structures of the 1950s, but we need to create new structures of social support that help us live healthy and well together. At Open Source Wellness, we believe that community is medicine. That if there's a secret sauce or an active ingredient in what we do, it's around leveraging the power of human connection and creating communities or cultures that are oriented towards health and well-being for all.
That's so exciting. And Benjamin, what kind of findings have you received?
What we've found so far is that we're able to reliably reduce depression by 30 to 50%, that we're able to drop blood pressure scores between 10 and 20 points. So we're really seeing outcomes that meet or exceed what we're able to get in kind of the classic medical setting. and all for much lower costs as well.
That's extraordinary. Elizabeth, what is most meaningful to you about this work?
You know, Ben started to speak to it. It's watching this arc happen of people coming in and experiencing joy and vitality and connectedness and a sense of hope and purpose, and then watching their mental health change, and then following that, their physical health markers change. So we see changes in blood pressure, blood sugar starts to come under control. It's really sort of a beautiful arc. But we watch that when patients get a little bit of hope, they get a little bit of traction, they meet a goal, they feel a little better, there's this acceleration of momentum that happens, and they start to take on things that matter in their lives. And that's what makes it worthwhile for me. You know, health is a big deal, but really we're talking about human thriving. And that makes it all worthwhile.
So exciting. And you're a nonprofit organization. What does that look like for this to grow?
It is a big mission, and I think it's an opportunity for people to get involved and make a difference. We're looking for funding partners, both individual philanthropists and corporate donors, to help us with our work in low-income communities where there really aren't a lot of resources. And then partners who want to help us spread and scale this model. We have interest from the VA, from Head Start, from emergency rooms who are interested in adapting this model to help reach different populations. So that's a big way that folks can help.
Excellent. Well, open source wellness certainly is a creative way to help people live healthier lives and to stop chronic illness in its tracks. You are making an enormous difference in the world, so thank you so much for joining us.
Thanks so much, Kathy.
Thank you. Thank you for watching. I'm Kathy Ireland.